Hey guys, today I would like to talk to you. I've been asked the question many times for the past few years. We have brought into our office different tools and different modalities to help people to heal faster and to get better results. So today I would like to talk to you about our high power laser. So we have brought in a laser a few years back, and it's called the high power laser. And what that means is, in the world of laser, if you don't really understand what that means and how it works, is there's different power to the laser. So the one that we have that we call the high power laser, it has a 60-watt laser, which is in the world of laser is considered to be high power. And in the world of laser, what we're looking at is we're looking at different wavelengths. So for instance, we have laser here in this office that are low-level laser therapy that have 400 nanometers or so, 405. We have some that are 635 nanometers. But the high-power laser has two different wavelengths. One of them is 810, which is 810 nanometers, and one is 980, which is in the world of laser, it's known to help, for pain. So people that have pain, it's effective for that. People that have sprain, strain, frozen shoulder, people that have any kind of musculoskeletal issues could benefit from using the high power laser, and also people that have neuropathy. So if you have a problem with circulation, when you're using a high power laser, it has the ability to penetrate into the tissue and increasing the microcirculation. As a result of that, it speeds up the healing process. So today we're going to go into the room in our office, which you will recognize where we're using the high power laser, and I will show you what that looks like a little bit, and then we're going to compare that laser with the other laser that we're also using, which is called a low level laser therapy. And you'll be able to see the differences. When we're using a high power laser, when you put it on the skin, it creates heat right away, and that kind of tells you that something is happening. The circulation is going on at that moment. And we're using that for any kind of musculoskeletal issues. We're using that as well, just to repeat myself here, with people that have neuropathy. And again, it has the ability to penetrate into the tissue at a deeper level than a low level laser. I know that there's a lot of confusion about lasers. Everybody talks about lasers, but believe me, they're not all made equally. You can have a laser pointer, right? You can use some LED light. Some of those lasers, they're like infrared light. They all have a different ability to do different things. And when you review the literature about it, right, you can see that, some of them don't do a whole lot, and some of them, they have the ability to do some amazing things, and they've been around for decades, and they work very well if they are used properly. So some of you, maybe you're using the high power laser right now, and you have been, you had it used on you, and you're like, what is that for? What is that doing? So in a nutshell, it's increasing the microcirculation. It helps with pain, and anything that has to do with musculoskeletal issues by nature, the high power laser has the ability to help that. So you're gonna follow me. We're gonna go in the room, and I'm gonna show you a little bit more about it. We'll see you in a second. Hey guys, it's me again. We are actually into the laser room right now, and this is the high power laser, also known as a class 4 laser. So if you're looking this up in the medical literature, you'll see that as a class 4 laser. And again, what I want you to know is, what is that good for, right? It's good for decreasing inflammation. It's good for tissue repair. It's also good for microcirculation. It's also good for preventing scar tissue buildup if a person have had surgery or something to that effect. So there's multiple applications to the high power laser, and as you can see here, there is a red light, and when you start the laser, right, you want to be moving it, because what it does is, as soon as you start it, you can feel the heat, because that laser has the ability to create heat into the tissue, right, and you can feel that right away. Matter of fact, we had a little bit of an experience. I'm not going to show you, but we used the high power laser on the chair, and they just created, there's a nice hole there on the chair. So maybe one day you can come look this. We can come and look this up, and you can see what it does. So hopefully this was helpful. This explanation. If you have more questions, you can ask one of the doctors about the laser, and we'll go to the next video, and I'm gonna teach you a little bit about those low-level laser therapy, which is a different type of laser which has different function, and so you can learn about that as well. We'll take care. We'll see you then. Hey guys, this is Dr. Jean-Guy, and today I'd like to tell you a little bit more about the modalities that we're using here in our office and why. So today the topic is laser. We use different lasers at our office, and I just want to share with you 2 different lasers that we're using and why we're using them. Number 1 is we are using this laser here. It's called low-level laser therapy. So in the medical literature, it goes by LLLT, low-level laser therapy. And this particular laser, they call that a derma laser. And the reason why they call it a derma laser is because 405 nanometers, which is the wavelength of the laser, is a good wavelength for skin problems. So this particular laser in our office, we are using it for skin issues. And I just thought that, you should probably know about that. There's a lot of people who are asking us some question about the types of laser that we're using, if we're using any laser, and why are we using them. All the lasers that we have, from a pointer laser to infrared light to a high power laser to low level laser therapy, those all have different capability and they all do different things. We also use this other laser. This is called the PL5, and this laser has 605 nanometers of wavelength. 605 nanometers of wavelength of a low-level laser therapy, right? Sometimes it's also referred as a cold laser, meaning that if we were to hold this right now, if we were to hold this on your skin, right, you would not feel any heat whatsoever. In your cells in your body, there is this thing called, on every cells you have photoreceptors, what that means is they're receptors for light. And those lasers, the way that they were designed, they have FDA clearance, and what they were designed, there's research that have been done on musculoskeletal issues, on people that have carpal tunnel syndrome, people that have any kind of musculoskeletal issues, and we mainly use that in our office for improving function, right? So the high power laser that we're using, also called a class 4 laser, we mainly use that for pain. It's good for a lot of different things. Every case is different, but I just want to kind of bring you up to speed on why we're using lasers and what they do. Lasers have been around for decades and decades. There's a lot of research in the medical literature, but again, lasers are not all made equally and they don't all do the same. So this particular laser, you could leave it on the skin for 20 minutes, you wouldn't feel the difference. That would not create any heat whatsoever. What it does is it can speed up the healing process. It will speed up the healing within the mitochondria. The mitochondria is the powerhouse within your cells. And what it does is it creates healing in the body. It speeds up the healing process. It creates ATP energy, right? ATP production without producing any free radicals. And just in plain English, if I can, translate that to you, as it will speed up the healing process. So people that have acute injuries or they have chronic injuries, we can use that PL5 or a low-level laser therapy to help to speed up the process. So some of our people in our office, they are using laser. There's some people that also can benefit from just, using laser therapy. So we also have some people that are just coming in to get laser treatment. So hopefully this was helpful. Just to recap, low-level laser therapy is different than a high-power laser or a class 4 laser. And the medical literature is, when you look up the medical literature about it, you'll see different things, how it helps, at different level, and how it helps the tissue, and how it helps the repair mechanism in the body, improve circulation, all of those good things that we can do with zero side effect, right? Zero side effect, that's the beauty of it. So anything that we are using in our office, the goal is always like, how can we make a person better, faster, right? And so they can get their peak potential, we can get your peak potential, and then allowing your body to function the way it was designed, and then to minimize the risk, meaning no side effect. So hopefully this was helpful to you, and we'll talk to you soon about other things we do in our office. Take care.